Immunotherapy is transforming the landscape of cancer care, offering new hope to patients who, not long ago, faced devastating choices between survival and quality of life. For decades, the mainstays of cancer treatment, surgery, radiation, and chemotherapy, changed and saved countless lives, but often at a steep cost. For many, these treatments meant facing the loss of bodily function, enduring lifelong side effects, or sacrificing hopes for future family. Now, a new generation of therapies, harnessing the power of the body's own immune system, signals a turning point in the fight against cancer. Consider the story of Kelly Spill, a young woman in her late 20s whose life plans were upended by a diagnosis of stage 3 rectal cancer. Like many, Kelly's first thoughts raced to her family and her dreams. The possibility of never carrying another child, the likelihood of needing a colostomy bag, and the shattering realization that her plans to wed in Switzerland had become impossible. Yet, what began as a personal tragedy soon unfolded into a journey of hope, resilience, and scientific innovation. After having her first child, Kelly had been looking forward to eloping abroad with her fiancé, cherishing the early months of motherhood. The cancer diagnosis, however, brought everything to a halt. The standard protocol, arduous chemotherapy, life-altering surgery, and fertility-destroying radiation loomed ahead of her. But in a twist of fate, just before beginning chemotherapy, she was offered a spot in a pioneering clinical trial testing an immunotherapy drug called dostarlimab. This therapy, rather than attacking all rapidly dividing cells as chemotherapy does or removing tissue as surgery does, empowers the immune system to recognize and destroy cancer cells. The specifics of Kelly's cancer made her eligible. Her tumor cells were mismatch repair deficient, a genetic trait present in about 3% of early-stage solid tumors. These cells have trouble repairing mistakes in their DNA, leading to a high number of mutations. Ironically, it is this very instability that makes them susceptible to immune-based treatments. When dostarlimab was introduced into her system, it acted as a beacon, flagging the mutated cancer cells for destruction by her own immune defenses. Over a series of quick, minimally invasive infusions, each lasting just half an hour, Kelly experienced none of the harsh side effects she'd braced herself for. After only 4 rounds, her tumor had shrunk by half. By her 9th treatment, it had vanished entirely. She was declared cancer-free, and more importantly to her, she learned she would not require the permanent bodily alterations or loss of fertility that traditional treatment would have enforced. Today, Kelly has given birth again, with another child on the way, a testament not only to her personal grit, but to the possibilities that immunotherapy can open for others. The breakthrough that changed Kelly's life is not just a personal miracle, but part of a growing body of evidence reshaping cancer care as we know it. In the recently published study, more than 100 patients with mismatch repair deficient tumors received dostarlimab, encompassing not just rectal cancer, but also colon, gastric, bladder, and prostate cancers. The trial showed remarkable results. Across 2 groups, 80% of patients who completed treatment with immunotherapy alone, no surgery, radiation, or chemotherapy, remained cancer-free after 6 months. Even more promising, over 2 years later, 92% of the patients remained in remission, with only a handful experiencing recurrence. For these men and women, the cost of survival no longer meant a trade-off with their quality of life. Organs were preserved, side effects were generally mild, and normalcy was preserved for most. Patients went on to conceive children, pursue careers, and reclaim futures that might otherwise have been lost. The durability of these results is especially noteworthy. 5 years after their initial diagnosis, dozens of participants, like Kelly, continue to live without evidence of disease. Yet, this dawn of a new era is accompanied by important caveats and questions for the future. Immunotherapy is not a universal solution. Its success hinges on the genetic makeup of each tumor. Only those with specific defects in DNA repair respond so dramatically. Hence, genetic testing, tumor sequencing, remains a critical first step for all cancer patients. Understanding the intricate blueprint of their disease can unlock the door to targeted, personalized therapies that may offer a cure without compromise. The shift away from surgery and radiation as the automatic standard for cancer care is profound. For more than a century, removing tumors or blasting them with radiation was the best available option, a logical response to an enemy that evaded subtler attempts at control. But as our knowledge of immunology deepens, new strategies emerge. These treatments encourage the body's own defenses to identify and eradicate rogue cells, often more precisely and with fewer side effects than blanket approaches of the past. This paradigm shift is particularly urgent amid rising rates of colorectal and other cancers in young adults, whose lives and fertility are especially at stake. In an age where cancer is affecting more young people, preservation of future options, whether to have children or simply retain normal bodily function, is more critical than ever. As the science continues to evolve, younger patients and their doctors are increasingly focused on not simply surviving, but surviving well. Still, the new research is just a beginning. While the results are spectacular, larger studies are needed to confirm just how long-lasting and widespread these benefits might be. Scientists are eager to see whether similar therapies can be adapted for a wider range of cancers, and whether they can be combined with other treatments to help those whose tumors do not respond as well. This emerging era also underscores the importance of vigilance and self-advocacy among patients. Kelly Spill's diagnosis was nearly delayed because her initial symptoms, constipation, blood in the stool, abdominal pain, were mistaken for ordinary postpartum issues or minor ailments like hemorrhoids. Her persistence, fueled by intuition and urgency, led to early intervention and ultimately a life-saving trial. Her journey is a reminder for all: trust yourself, push for answers, and never assume that youth guarantees immunity from serious illness. As more patients and families are touched by new treatments, the message is clear. Immunotherapy represents more than just an alternative to surgery. It is a beacon of hope in a field long stymied by trade-offs. It heralds a future where cancer care may be curative without being cruel, where people can heal without losing themselves in the process. The road ahead will require continued research and, above all, broad access to genetic testing and clinical trials. For now, stories like Kelly's inspire clinicians, scientists, and patients. They represent a vision of cancer care no longer defined by suffering, but by resilience, recovery, and the preservation of life in all its fullness. As medicine advances, may this new paradigm of hope, that the cure does not have to be worse than the disease, become the reality for all. Thanks for watching. If you enjoyed this video, please don't forget to like it. Also, leave a comment below. Finally, make sure to subscribe to the channel. Thanks for being part of our community.